I was hoping to do a kind of off the cuff video about how I treat my mental illness. And by off the cuff, I just mean that I didn't prepare much for this. But so I don't have like an outline that I'm going by. But I wanted to talk about how I treat my mental illness in this video because it was recommended. A friend of mine suggested that maybe I should do a video like that. I have, well, my diagnosis is schizoaffective, type bipolar. And my mom's laughing in the background. I think you can hear that. She's reading a good book. But okay. My diagnosis is schizoaffective type bipolar. And I'm going to talk about how I treat myself, what regimens I do, what medications I take, and also what techniques I use to maintain stability that are not medicine or therapy, but are anything that a doctor prescribed, but that help me feel like I'm stable and well a lot more than most of the time. I wanted to say that just quickly that I'm a little tired this morning, just in case if you might have noticed. I was a little restless sleeping last night, so that's how I am today. I generally do get wonderful sleep actually, but I sometimes when I'm starting to like get out of a depressive spell by doing things that'll help me do that. One of them is walking more. I get into a phase. It's not even hypomanic. It's just being more excited about life, really, I think. But it can make me a little restless at night, and I can even miss a little sleep because of it. But which isn't always good. But that only happens like once a month. Okay, so from the top. Okay, the medications that I take. I take two medications for my schizoaffective disorder. I'm very fortunate for that because a lot of people are on three or four or five or even more. And it is true that the fewer number of medications you take is helpful because the side effects are present with all medicine. So, all right. Um, the first medication that I take is an antipsychotic. It's an atypical antipsychotic called Abilify. And I also take a mood stabilizer that I started more recently. So I've been on Abilify for about 20 years. I've been on the mood stabilizer for 5 years. That's pretty good. Anyway, so it's been 5 years since I've been in the hospital. Almost 5 years. But before that I went 15 years before I was in the hospital. But my mood stabilizer is called trileptal or oxcarbazepine. Um, okay, so that's all the medicine that I take. I just have to take it 2 times a day. One of them I take 2 times a day. One of them I take 1 time a day. Pretty simple. It gets prescribed by a nurse, and I don't have to. I don't have to go to the doctor more than once every 4 months. I think for that, or maybe it's every 3 months. I think it's every 3 months. So when I say the doctor, I mean the nurse. So because they don't give me a doctor, basically, because I'm too poor to have a doctor. No, not really. It's complicated, but they just they have she's under a doctor's supervision, I think. But yeah, I see a nurse, a psychiatric nurse. Um so medicines for mental illness are just like medicines for physical ailments. It doesn't have much difference. If you need to take something for diabetes, it's similar to having to take something for my illness. Anyway, there doesn't have to be a stigma. Okay. Other treatment methods. So I mentioned exercise, walking. When I get depressed, especially, walking helps me elevate out of the depression. Um, so I've swum, that helps me. Um, Dancing, yoga, but the main one that helps me is walking. Nature therapy, especially earthing therapy, helps me a lot. I do that for an hour every day. As you probably, if you look at all my videos that I've ever put out, you're like, this girl sits on the earth with her feet for a long time every day. And that's something I just do. And it helps me become peaceful. Um, I, I try to eat my vegetables, and honestly, I think that that really helps in a way. Um, I count 100 breaths every morning, or at least one time a day. One time during the day, I sit there and do a meditative technique where you count your breathing in and out, and every time you breathe in and out, you count one time. I do other meditation techniques, so meditation is definitely something that I do for my treatment. I mean, they're basic things like drinking enough water, or my mom's really laughing a lot. Um, Drinking enough water, exercising. Are you aware that I'm making a video? You're getting in it. It's okay, Mom. I just want you to know you're going to be in a YouTube video. Uh, anyway, sorry. That's struggles of living in a household with someone else. And filming a YouTube video. I don't know if you all did hear it or not, but she was cracking up. Okay. Because she's reading a book. That's funny. Not really. She's reading Charles Dickens. All right. Let's see here. Other things that I do for my stability. Going to therapy is a big one. Writing out my thoughts is a really big one. Journaling, writing poems, writing essays, making YouTube videos, expressing myself, making art. These things are therapeutic for me. Um, Trying to think, what else do I do? Because I didn't write it out, and I think I'm gonna skip over something. I mean, there are a lot of things that are just givens, like following doctor's orders. Um, Having good, like having a house. There are things that can help, like being able to live in a place where you don't have to worry about stability, or um, having a lawyer if you need one. Like there are a lot of things that can help someone with my diagnosis. Um, Trying to think. I think that I've actually covered the majority of the treatments that I do. And what I was going to say is the treatment works for me. Like, for a long time, there were many problems, but I've had this illness since 2000. And I struggled with it like crazy. Like, I was not doing good for the first 4 years or something like that. But, like, and it took a long time until I was able to feel like I was myself. Even after the first 9 years, I didn't feel good enough. A lot of the time, I had these existential crises a lot that really hurt. And I was very unstable on that medicine when I was on Depakote. It didn't stabilize my mood in the right way. It didn't take the mania away. This one I'm on takes the mania away. Like, I don't have the mania, and I don't want the mania. So basically all that I have symptom wise that I can count since I got on this new mood stabilizer is depression and anxiety. So, do I have a major illness, or do I just have depression and anxiety? I mean, I kind of like am like, wow, I'm doing good. But anyway, I hope that no matter how you find this video or what stage you're in your wellness journey, that it doesn't come across like I'm boasting when I say that. Like, that you realize that I'm just saying, like, you can thrive too. If you keep it up and do the work, you can thrive too. Um, Thank you for watching this video, and I'm sure that I left some things out. I was gonna ask anybody who happens to have sat through this long, do you notice the difference between the way that I have the camera now versus my other videos? Like, all my other videos where I'm sitting in front of a similar place, like my previous most recent video. Like, is this an improvement? Because somebody told me that I should have the camera at eye level, and I now have put it to eye level, but I kind of think it shows too much of my torso. I'm trying to decide if I like it better this way or the previous way. What do you think? Okay, thank you for watching.